The thing that we didn't know in particular, Mr. Speaker, was that COVID could be transmitted asymptomatically.
It looks quite likely that there is some degree of asymptomatic transmission.
The thing about this disease, it's an invisible enemy, and we don't know who's transmitting it. Just, Patrick, on the numbers of people who have the disease asymptomatically, there was a study I saw quoted from some Oxford academics saying that as many as 50% may have had it asymptomatically.
That's a small percentage of the population who were tested positive. Quite a number of them were asymptomatic in a town in Italy. Quite a number of them were asymptomatic.
We ministers were not told about the asymptomatic transmission.
If only then Health Secretary Matt Hancock had been listening to BBC Radio 4 on March 13th, 2020, he would have heard the government's own Chief Scientific Advisor Patrick Vallance say this.
It looks quite likely that there is some degree of asymptomatic transmission.
But it wasn't until a whole month later that the Health Secretary introduced a policy to test care home patients before discharging them from hospital.
Today we've strengthened the rules so that all care home residents who are discharged from hospital will be tested before being admitted into their care home.
By that time, a staggering 25,000 people had already been discharged from hospital into care homes without being tested for coronavirus. It almost certainly contributed to the catastrophe which occurred in our care homes.
More than 20,000 elderly or disabled care home residents died from COVID between March and June 2020 in England.
In fact, Sage said asymptomatic transmission cannot be ruled out in early February 2020.